Greetings and welcome. My name is Selena Belisle. I am the founder of CE Institute and one of the instructors here where we teach prenatal massage. And we wanted to give you a sneak peek into our prenatal body cushion training for massage therapists and other practitioners who would like to practice prenatal massage, whether you're an occupational therapist, nurse, PT, and more. We have some research that shows the efficacy of using a body cushion and pronating a pregnant woman in the latter stages of pregnancy. Now, for a long time, it's been thought or even taught that pronating a pregnant woman during prenatal massage is ill-advised because it could strain uterine ligaments. And while I do agree, massaging with tables that have large holes in them, that were not custom made for a specific size pregnant woman, that allows this pregnant abdomen to dangle in a pronated position, that in itself is likely going to strain the uterine ligaments. However, I do think the use of prenatal body cushions, when they're properly positioned and adjusted, they can alleviate some pressure for pregnant women. I have it in research published on PubMed.gov, the National Library of Medicine, and I don't think it's straining the uterine ligaments. I have never had a client in probably about a quarter century of prenatal massage practice, and that's how long I've been using these cushions, forever, since I started prenatal massage. No one's ever come back to me and said they felt some type of straining or pain in their abdomen after being pronated. Keep in mind, you have to properly pronate, and that's one of the things that we teach here at CE Institute. So this is the research that we found, and there's very, very little research when it comes to pronating pregnant women, specifically for prenatal massage. However, this was published in 2018, and we try and teach from research, not just what my personal anecdotal experiences were or the other instructors' experiences. We love to find things in research that were objective and studied amongst groups and cite other research and more. And in this article, it's titled "The Prone Position in Healthy Pregnant Women and in Women with Preeclampsia" as a pilot study. And we do not massage women with preeclampsia, especially if there's proteinuria, where toxins are in the blood. You wouldn't want to massage that. That would increase circulation and increase the toxins circulating around the blood, which can affect the kidneys and your vision and so forth. We would consider that contraindicated. But the prone position in healthy pregnant women, I do think, is indicated when you're able to position your body cushion properly. So the background on this, they wrote, and I'm going to read to you, and then I'm going to give their research sightings. They wrote, "The prone position is a position in which a person lies horizontally with the chest down and back up." They're just explaining what pronated is. And then they wrote, "With appropriate pillows, it's considered a safe position for pregnant women. The position is utilized in the allied health fields for relaxation and massage in pregnancy." That's us. We're part of the allied health fields. And they said, "In this position, uterine compression of the large abdominal vessel is almost completely alleviated with a concomitant reduction in abdominal vascular resistance and improved abdominal blood flow." So when you have the latter stages of second trimester, third trimester pregnancy, your fetal baby weight starts to increase rapidly, especially in the third trimester. And sometimes the fetal body weight can, in the amniotic sac and the whole uterus, can start pressing and compressing the inferior vena cava. So that is partially obstructing cardiovascular circulation. It's one of the reasons why pregnant women's legs can swell too, because sometimes blood flow is obstructed in the latter stages of pregnancy. So what they're saying here is pronated actually might be good to improve circulation. There is a research study that was published here, The Effects of Maternal Prone Position on Umbilical Arterial Flow. And they found that umbilical arterial ratio and prone position significantly decreased with that in the supine position. And that right and lateral position side lying showed no significant change. So their conclusion was the maternal prone position can provide complete relief of uterine compression of large maternal vessels. Now, here is another research that they studied of a pregnant woman who had some blunt chest trauma, and she was pronated at 34 weeks gestation. And they found that she was able to improve with this pronating. Here's another, I looked up this research here. Let me make sure I got all of these researches. I did. Pregnancy, prone, and ligament at the National Library of Medicine. Because so many people have been saying pronating pregnant women strains ligaments. Pronating pregnant women strains. I've been hearing this for 30 years. And I've been practicing a little bit over 30 years and prenatal for about 25. And it's really interesting. There are only 5 research studies that came up with this search on PubMed. And I mean, when you look for things on PubMed, pregnancy alone, there's only 1,171,000 research results, right? But no one has published anything about ligaments in prone position. And if it was so harmful, it'd probably be published by now, but it's not. The opposite is published. We have several research studies that said pronating pregnant women could actually be helpful. So I'm going to show you how we set up a body cushion. And this is how we would pronate a pregnant client for prenatal massage. Now, it's important that you obtain proper prenatal massage training before attempting to do anything of this. This is just an instructor demonstration. I'm showing the breast recesses here and the upper uterine and lower uterine recesses here that make up an abdominal recess for your pregnant client. These usually have Velcro attachments so that you can expand the body cushion and make the recess deeper and deeper and deeper for your pregnant client. I'm now putting the cervical support with a cervical face cushion on, which can be elevated with additional cushions during prenatal massage. In here, I'm separating the upper and lower torso cushions so that I can start putting adjusters in. Okay, this is a large adjuster caddy made by Body Cushion, and these small triangular cushions go on the sides in between the upper and lower body cushions so that you can create additional space for that abdominal recess. And you can see how there's additional space there, and it's creating a larger recess for the pregnant abdominal area. Now, these are additional adjusters. They're kind of triangular in size, and they taper off. They're maybe 2 inches high, and then they taper to practically nothing with that triangular shape there. So we usually use these triangular bolsters first to lift the body cushion and create a larger recess. I'm going to move the camera forward. I shot this during COVID alone, so there was no one to assist me with the camera here. And when you lift these body cushions, again, you're creating a deeper and deeper abdominal recess. Now we have these body cushions that are more rectangular in shape. If you have somebody who's 8 months or greater, or even a 6-month pregnant woman with twins or triplets, you would want to continue to make a larger recess to accommodate a larger pregnant abdomen. So you can see here, we're really creating some great space here for a pregnant abdomen. It's quite deep. And what's nice about this is, can you see the upper torso, how there's that really thick foam in the underneath the purple vinyl? We have these in blue, black, purple at the school. They come in multiple colors. We're going to add some more triangular adjusters here. They usually only recommend 2 at maximum in between here. And there's Velcro to attach these. This creates a really deep recess for pregnant abdomens. So I'm now getting a gallon of massage cream just so you can see how deep this recess is. And you want to make sure that, like the upper shoulders, there's padding there to hold on to the client so they're not lying directly on swollen breast. See how deep that recess is? It's pretty deep. Because we don't want clients lying on their swollen breast. That could create pain in itself. And if they're lying directly on their shoulders, then there might be some pressure on the abdomen as well. We love these prenatal body cushions that have some type of shoulder lift and elevation, and these do too. These are the ankle bolsters that would be used for pronated position. What's nice about these is they separate. So as relaxin allows the pregnant woman's pelvis to expand and prepare for delivery, you can separate those ankle bolsters and allow for a pregnant woman to leave their legs a little bit wider on the table in pronated position than might be normal. Now I'm going to show you how we set up the prenatal body cushions. First of all, we always use a new face cradle cover, and we sanitize the face cradle cushion in between every client. I have a fitted sheet here on the bottom of the table, but you could also put a flat sheet on there as well. Now we always use 3 sheets when we're doing prenatal body cushion massage. The second sheet would be a flat sheet, and we're going to take lots of extra sheet and pull it up over the top of the table. We'll show you why in prenatal massage training if you pursue that with us. Now there's also a cervical bolster. If you have somebody who has that large of a recess because they're that pregnant, you're probably going to need to lift the face rest as well. Okay, and I'm going to turn this upside down here so that that face cushion can be elevated so their head isn't draped, and falling down, and their sinuses are really filling up while they're pronated. So now I'm going to put the third and final sheet on. That's the sheet that your client would be covered with for modesty and privacy. You always want to make sure that your pregnant women are draped in prenatal massage, including prenatal body cushion massage. So this is how we would drape our table. Now you can put a blanket on this if you'd like, but if you have somebody who's 8 or 9 months pregnant, they're probably really warm from all that extra blood volume, right? So usually women who need this much body cushion accommodation would only have a sheet covering them, and they might even think that's a little warm. Now, keep in mind, there's a lot more to learn about using body cushions. That was only a setup. When the client gets on, we need to check it and so forth, which we review in our prenatal massage training. Now I want to show you the body cushion that they used in research. I'm not in love with this one, but they did have pictures, which was great. And you can see here there is an abdominal recess, and they do have some support around the abdomen so that the client is not lying fully on their abdomen. And they even showed the client lying pronated here as well. I don't think this is the best use of a body cushion. First of all, I like to have that chest support up top so that the shoulders are elevated too, so there's less pressure on the abdomen. Also, I absolutely insist on an ankle bolster here because the weight of the pregnant woman's legs can pull down on the pelvis here. It might cause some low back or hip issues when they're lying there pronated. We do not like to pronate our prenatal clients in the cushion for longer than 30 minutes. I think it's great. It takes pressure off from some of their uterine area, and it obviously improves cardiovascular blood circulation. We know that from research, but they need to be properly positioned in a better body cushion in my position, and I want to see some better positioning here too with the ankle bolsters. Now I'm going to show you just a minute here of what it looks like. This client is a full-term pregnancy. She's about 9 months pregnant, and she's in the body cushion, okay? We made sure that she got onto the table in a way that was comfortable for her. This is at the school at CE Institute in downtown Miami, and I'm holding the drape to expose her hips, keep her gluteal cleavage covered, and she was very warm in the cushion, so it was okay with her for just the sheet here. So you can see how the shoulder is elevated, and then there's a huge recess for this almost 9-month pregnant abdomen. Very large abdomen in the front there, buried in the recess. And she said it felt incredible. That's the feedback I've been getting for over 2 decades of using prenatal body cushions. There's a lot out there, and we have many different name brand body cushions at the school. And what we do in our live in-person prenatal massage classes is we set up all these different body cushions all over the classroom. And then the students run around with their face cushion covers and sheets, and they cover it up, and then they start trying out, and they lie in all the different body cushions. And there's no clear favorite. There's many different body cushions out there with different types of foam and vinyl. And, it's usually the class is split a percentage amongst all the different body cushions that we have. So that is what I have to present with you here with prenatal body cushion massage. We do like to teach from research. We love it when we can show that something's been proven to be effective with our massager bodywork. And we hope that you will come to the school and train with us so that you can learn more from research with us. We think it's a great practice. Our website is ceinstitute.com. If you liked this sneak peek, please like us on our YouTube and our social media so you can be notified when more little free sneak peeks come out. And until we see you in a training, please be safe.